Hello, my name is Gemma and I will be speaking on mantra meditation for post-traumatic stress disorder in yoga therapy and clinical settings. So I am a part-time researcher, postdoctoral researcher, and part-time meditation facilitator and educator. I teach corporate workshops and also training for yoga teachers, therapists, and health clinicians. So really aiming to get that science out of the science journals and into the clinics. So this project's aims is to educate clinicians and yoga therapists on mantra meditation as an alternative or additional treatment for post-traumatic stress disorder. So what is PTSD? It's a mental health condition that can develop after a traumatic event, or complex PTSD, which develops after a series of events. Some of the symptoms include distressing memories, nightmares, flashbacks as though the event is reoccurring in real time, negative or intrusive thoughts, difficulty sleeping and focusing. And one of the main symptoms is actually hyperarousal, so just a constant alertness. The American Psychological Association has some recommendations for treatment of PTSD. They strongly recommend cognitive behavioral therapy as well as prolonged exposure therapy. They have some conditional recommendations as well as medications. Now, the medications can obviously lead to unwanted side effects. So they're usually a last resort, but can be helpful for some people. And the strong recommendations, so cognitive behavioral therapy is a way of looking at negative thought patterns or unwanted thoughts and then reframing them. Often this is done by journaling. Then prolonged exposure therapy is exposure again to the trauma, so remembering the trauma and then working through that. So sometimes there are issues with cognitive behavioral therapy and prolonged exposure therapy with bringing up the trauma. So some people find that it's too intense and not helpful to bring up the trauma again consciously. So unconsciously, of course, they're having those intrusive thoughts. But also some people cannot actually bring up the trauma. So it can be, there can be some issues with those therapies. So I'm speaking about mantra meditation as a treatment, which can be combined with other therapies. It can help replace negative thoughts with focused repetition of either the mantra, prayer, or chant. It engages the parasympathetic nervous system, and individuals do not have to recall the traumatic event consciously. So what is mantra? It's a Sanskrit word coming from manas, which means mind, and tra, which is truth, tool, or liberation. So liberation from the mind, finding the true mind, or a tool for the mind. It is a sound or phrase that is repeated. It can be done aloud or mentally, and it can also be done individually or in groups, and it can be done in many different ways. So it could be a formal practice alone, at home, sitting, maybe at an altar, or it could be something where someone pulls out some beads on the bus, like a mala, and starts counting repetitions on the bus to stay focused or feel safe. It can also be done in a musical way with different instruments and dancing in group where it's vocally sung. So there's many different ways, and obviously all of these different ways will have different impact for people. But generally, mantra aims to increase self-awareness, self-regulate the mind and body, and also induce altered states of consciousness. So get away from mundane ways of thinking about the world and alter our perspective of the world. In these states, so some of them such as ego disillusion or mystical states, people often feel a connection with our surroundings or with other people. They feel a sense of unity. So these states can be a way of reducing stress. There's no research that I know of looking at the negative impacts of these states, but of course we know with psychedelics these altered states can also sometimes lead to negative effects or a negative experience in that altered state. So that's also something to be mindful of here. So some of the benefits of mantra meditation include stress reduction. So we found after just 12 minutes of chanting Om in a group, so with that extended at the end, it can reduce cortisol, the stress hormone. It also reduces psychological stress or perceived psychological stress. It can also lead to feelings of connection with others when it's done in a group. Improved emotional regulation. It's also cost effective and, as far as we know, quite a safe practice. It's accessible and portable. So as long as someone can remember a sound, they can use this wherever they are. They can be on a bus or on a train and be repeating a sound silently if they have any unwanted thoughts come up. So why mantra might work for something like post-traumatic stress disorder. Here's an image here that just demonstrates the two different things. So post-traumatic stress, we have these ruminative thinking, this constant memory of the same thing being repeated and repeated in our minds. And that's actually exactly what we're trying to achieve with mantra. It's a constant repetition of a sound, only it's a sound that we want in our minds. So we repeat and we repeat and we repeat. So you can see how that can lead to a distraction and also redirect the focus to something that we want to focus on. Before I go on to the research, we're going to do a very short practice just to get a sense of how we can work with mantra. So this is using the mantra so, hum. So on the inhale and hum on the exhale. And we do this just mentally. So if you feel to, please close the eyes. You can keep them open, which is sometimes also useful for people experiencing PTSD. So that's good to be mindful of as well. So just focusing on the navel center and the throat pit, we're going to actually visualize the breath going up and down. If you know Ujjayi breathing, you can do Ujjayi breathing from the belly button to the throat pit and the throat pit to the belly button. But if you don't, then just use your natural breath, inhaling, visualizing it going up that frontal passage of the body from the navel to the throat pit, and down on your natural exhale from the throat pit to the navel. And now we'll add the mantra. So we visualize the sound so on the inhale and hum on the exhale, and just working with your breath in your own time and mentally repeating those sounds. If your mind wanders, then that's fine. Just bringing it back to the mantra and the breath. And letting go of the mantra now, letting go of any breath control. Notice how you feel. Perhaps bringing a little bit of movement back to the body, maybe stretching the arms up overhead or whatever feels good. And if you did close the eyes, then opening the eyes whenever you're ready. So you can see how you can do, that was a very, very short practice, but just as an example, you can do a silent repetition, but also include visualization so that we have these layers for the mind to focus on. So I'll speak about some evidence for mantra as an intervention for PTSD now. There was a randomized control trial done on 173 veterans with PTSD, and they looked at mantra repetition compared to a present-centered therapy. They had 8 one-hour weekly sessions, and the results of that were greater reductions in PTSD symptoms and insomnia for the participants in the mantra repetition group. And then at a follow-up, 59% of people in the mantra repetition group no longer met PTSD criteria compared to 40% in the control condition. Another study looked at transcendental meditation, which is repetition of a mantra silently. This one had 29 veterans, and they looked at 8 weeks of transcendental meditation training, which included 14 hours in group and individual sessions. They were also told to meditate twice a day for 15 to 20 minutes. Results showed a reduction in PTSD, depression, and somatic symptoms, and increased mindfulness as well as quality of life. Some other studies have looked at how mindfulness can impact PTSD, and they have found that to mediate symptoms as well. So some systematic reviews have shown that meditation-based therapies, including mantra, transcendental meditation, repetitive prayer, chanting, can improve PTSD symptoms, and also that there have been positive effects on depression and quality of life. So what these studies find is that frequency matters. So higher frequency is linked with reduced PTSD symptoms, reduced anger, and improved mental and spiritual well-being. So what does this mean? Well, mantra meditation may be an alternative or an additional treatment for PTSD. It can also encourage cultural inclusivity in mental health care because there's many different traditions that use these types of practices. So we can encourage participants and our clients to use the practices that are meaningful to them. And it means that people will have a tool with them wherever they go. Next steps may be training health practitioners on social prescribing of mantra meditation, repetitive prayer and chanting, and some more high quality randomized control studies. So thank you so much for listening, and please get in touch with any questions or comments, or if you want more details on the literature that I've mentioned or other literature. My email is om@drgemmaperry.com, and there's my website there as well. Thank you.